Well, February is Heart Month, and we're going to learn more about that. Joining us today, Dr. Sandeep Patel, Director of Structural Heart and Interventional Center at Mercy Health St. Rita's Medical Center. And then we have Anna Kleman. She is Structural Heart Coordinator for Mercy Health St. Rita's Medical Center. And thank you both for joining us today.
Thank you.
Thanks for having us.
All right, so first of all, Dr. Patel, tell us more about Heart Month and why it's so important to recognize a whole month.
Thanks, Holly, for having us again. Heart Month starts in February, and obviously in conglomeration with Valentine's Day, it makes sense. But the American Heart Association wants to focus on really understanding that what the heart is, how it manifests in terms of symptoms, and what we can do to help treat those symptoms if we identify them early. In addition, the AHA really supports preventative measures in terms of cardiac health. And it really does take a whole month of understanding every type of issue that the heart can have and what we can do to prevent those issues. And if we don't prevent them, how to treat them. And so they really want to emphasize for the next, 29 days that really heart health needs to be a focus in your life, and it should continue on not just for this month, but throughout the year.
Right. Okay, so let's start with prevention, and I assume that means like a healthy lifestyle and that kind of thing. So what kind of things should we be doing so we don't have to see you?
Right. So the obvious things are still obvious. Diet and exercise, try to move 30 minutes a day, eating fresh food, non-processed food, and then portion control. Those things are really going to be at the fulcrum of heart health. And then obviously listening to your symptoms and not attributing everything to aging. There seems to be a misconception that as you age, you should start feeling fatigue, tiredness, exhaustion, shortness of breath. But although some of those things can come with aging, a lot of times new symptoms or new onset of these symptoms tends to not be aging related. Instead tends to be an actual pathology that needs to be looked at.
Okay, so like your role then as an interventional cardiologist and with the center, what kind of things do you do?
Yeah, so interventional cardiology is a facet of cardiology in which we work to try to fix the heart without doing open heart surgery. Traditionally, we kind of relate that to putting stents in people's body, really in the heart, and sometimes in the legs. But structural heart is a facet of interventional cardiology that deals with treating things like holes in the heart, valves that are leaking, valves that aren't opening, muscle problems, chamber problems, and a whole host of things that can go wrong with the heart outside of just blockages that everybody's kind of aware of, which can lead to similar symptoms, but require completely different treatments.
Mm-hmm. And you're there to kind of like coordinate things and get people going. Are you seeing a lot of these cases?
Yeah, absolutely. So we see a lot of patients in the clinic. And then from there, Dr. Patel will see them, kind of go over what symptoms they're having. And some people, like Dr. Patel said, they just think, oh, I'm getting older. This is normal. I'm slowing down. But in reality, they have an underlying issue. So Dr. Patel will speak with them. And then from there, there's an entire team of invested people that are vested into the health of that patient and their family. So from there, we coordinate everything and we get them through to the procedure, and then we follow them for many years after.
Mm-hmm. So are things improving? I mean, are procedures done, I don't want to say easier, because every procedure is, really important and hard. But, I mean, is the treatment getting better, I guess, for this kind of heart issue?
Yeah. So, I mean, as time goes on, technology improves, and the evolution of technology makes things better for the patient. So the procedures that we do now outside of heart stents, which I would say is pretty much the most refined procedure in interventional cardiology we do, which is putting a stent in the heart. But in terms of valve therapies, replacing valves, fixing leaks, closing holes, blocking off areas of the heart that are hurtful to the patient, those procedures have only gotten better with time because companies and the people that are developing these procedures realize what needs to happen to actually make it a patient first type situation. At St. Rita's, we actually get privy to a lot of the new technology early on. We bring that here. Sometimes we even get to try it out on models and things before we actually do it on a patient, so that we can actually see the benefits that have evolved in certain devices. Everything we do now is FDA approved, but the FDA also approves newer devices. And before we try it on an actual patient, the team is really prepped and kind of versed in how to manage that and kind of gets through the nitty gritty of what's different about the device now than it was prior to the iteration. So, yeah, I would say the team is well versed in the procedure that you're going to have. And the other options that that come along with these procedures are the other high risk situations that can occur during procedures. I think most patients think that doing a procedure just means going in, doing the procedure, and coming out. When we quote risk for procedures, it's anywhere between 1% and 5%, depending on the patient's risk profile. But that becomes a real thing for that 1% and 5%. We do more than 200 cases of structurally related situations a year. And that can equal somewhere in between 2 and 10 patients. So we really need to make sure that we have all the backup plans. So when we plan for your procedure, it's never just a procedure. It's what if something happens? What if they're that 1%? What are we going to do if this happens? And all of those plans are also in place for the patient, whether they know it or not. We really take it to heart that we are trying to avoid opening their chest. We're trying to avoid having an issue with their vascular system, and we're trying to get them home as quickly as possible. And so these things, which Anna works on with the whole host of team members, including cardiac surgery, vascular surgery, the heart failure clinic, the general cardiology clinic, the imagers, et cetera, are all available at the time of their procedure. So they know that they're getting the best procedure possible, but then they're also getting the best bailout and secondary procedures if needed to get through the procedure.
It's a whole team working for us there at St. Rita's. Wow. Thank you very much for tip of the iceberg in this kind of issue, but it's Heart Month and we need to know. So thanks for joining us.
Thank you.
Thank you.
All right, don't go away. New Edition continues in a moment.